An image zooms into the screen against an all-black background. The text reads, "Arts for the Aging," and is positioned to the right of a logo. A three-colored flame of red, purple, and yellow joined together into a single point at the bottom and blooming upwards into three separate points. A new screen emerges with an off-white background and the Arts for the Aging flame positioned in the center with text. The text reads, "Arts for the Aging's mission is to engage older adults and care partners in health improvement and life enhancement through regular participation in the arts. Our goal is to stimulate minds, bodies, spirits, and imaginations. We are nationally recognized leaders in creative aging and pioneers in arts programming for older adults. Learn more at www.artsfortheaging.org. A new screen appears containing more text on a similar off-white background. It reads, "About the Aging and Integrative Pain Assessment and Management Initiative, parentheses, AI-PAMI. Below these words are two logos. The first is associated with the Aging and Integrative Pain Assessment and Management Initiative, and the second belonging to the Florida Blue Foundation. Between the two logos are two hands, one blue and one white, joining together in a handshake. The text below the two logos reads, AI-PAMI is a comprehensive project addressing non-opioid pain management in adults ages 50 and older living in Northeast Florida. The overall goal of AI-PAMI is the advancement of innovative pain education and patient care through the development of provider and patient workshops focused on integrative pain management. Funding provided by Florida Blue Foundation and the Florida Medical Malpractice Joint Underwriting Association. Visit pami.emergency.med.jax.ufl.edu to learn more. Contact PAMI at pami@jax.ufl.edu or 904-244-4986. The final title screen appears with the words "Rhythms of Life" across the center. Below that are the names of the presenters for this video: Manny Arciniega, Chris Brown, and Dr. Mitchell Kosak. At the bottom of the screen, more text reads, "Presented by Arts for the Aging in collaboration with the Aging and Integrative Pain Assessment and Management Initiative, parentheses, AI-PAMI, at the University of Florida College of Medicine, Jacksonville." As this screen fades, a new image appears. An older man with a blue short-sleeved shirt sits in a small room adorned with various musical instruments. The man is center screen with his upper body in view. Occasionally, you can see his bare arms gesticulating to the camera. He has a trimmed beard and mustache and the same gray and white complexion as his full head of hair, and is wearing a pair of thin-rimmed glasses. The room where he sits contains a slight hue of yellow, punctuated by the flesh-toned colors of the animal-skinned drums, tambourines, and other assorted percussion instruments hanging from the walls. To the upper right of the man is a single small window decorated with a pair of bongos and a few more percussion instruments. He is seated next to a black upright piano, with the ivory keys running perpendicular to his shoulders. On top of the piano is a bouquet of assorted flowers, which includes about half a dozen sunflowers.
Hi, I'm Dr. Mitchell Kosak, and I'm a clinical mental health counselor and an expressive arts therapist, and I've been working in the field for about 40 years. I'm also a professor of counseling and expressive therapies at Lesley University in Cambridge, Massachusetts. I'm also a professional musician, and I've worked clinically with all kinds of populations, including the elderly, for many years. My research is focused on how the arts, and specifically music and rhythm, can contribute to health and well-being. I've even written a book called Attunement in Expressive Arts Therapy Towards an Understanding of Embodied Empathy. Now, in my research, I've looked at current and past trends as it relates to sound and rhythm for a variety of populations. Today, I'm going to talk a bit about how music and movement affects pain with older adults. Speaking specifically about research related to music and pain, there have been many studies done that show that pain pathways can be interacted with when listening to or engaging in music. For example, there was a study using functional magnetic resonance imaging, or fMRIs, and the researchers compared individual brain activity when they were listening to music or when they were just sitting in silence. And they found that when they were listening to music, there was much more activity in certain regions of the brain, and specifically those regions that activate the descending pain modulatory pathways. Now, other studies have shown the effect of music listening on anxiety in older adults. In a geriatric emergency department, it was found that there was significant reduction in anxiety scores following music listening to recorded music, and specifically recorded music that was at 60 to 80 beats per minute. Now, we're going to talk about these beats per minute in a little bit, but I want to tell you a little bit more about some research. In a Turkish emergency room, they examined the effects of listening to music during 3 painful casting procedures, and they found that reduction in anxiety and pain was lowered significantly when they were listening to music. In yet another study, music was found to have positive effects in patients with chronic painful conditions such as fibromyalgia, rheumatoid arthritis, or osteoarthritis. In another study by Mitchell and McDonald, they found that their participants controlled pain substantially better when they were listening to their preferred music compared to non-preferred music. It's really important that you listen to the kinds of music that you like when it comes to reducing pain. So, certainly, music can have a great effect on pain management. And now, we're going to experience a little bit of that as we listen to a musical guided meditation by Arts for Aging teaching artist Chris Brown. Enjoy.
A large Arts for the Aging flame logo appears in the center of a black screen. Text in all white lettering reads, Arts for the Aging teaching artist, Chris Brown. The screen fades and then reveals a seated individual wearing a gray stocking cap, a long-sleeved dark blue collared shirt with the sleeves rolled up to just below the elbows, and a pair of black trousers. The camera is positioned above the person's head in order to look down at both the individual sitting in the center of the room, but also the musical equipment he is performing on. Chris is holding an electric bass guitar, and his bare feet are controlling nearly 24 different effects and recording pedals. Occasionally, an image of Chris speaking into the camera appears. He is a middle-aged, light-skinned man with a thick goatee and mustache. His hair is covered by his gray stocking cap, but his facial hair reveals tints of blonde and brown with streaks of gray. He is speaking into a microphone in a seated position.
Thanks for joining us today. For those of you who are experiencing pain now, we're going to do a guided visualization that's going to go along with this soothing music that you're hearing now. So to start off with, find yourself sitting comfortably in a chair. Make sure you're balanced from left to right, that you're not leaning too hard on one side or the other. Just take a nice deep breath and let it go. Another breath in and release. And one more. Breathe in. And as you breathe out, let your eyes close and center inside on the breath. Keeping breathing in through the nose, out through the mouth. As you breathe in, inflate the upper part of your chest, around the solar plexus, and down into the belly. And as you breathe out, let each of those 3 zones deflate. 1, 2, 3. So now we can begin to go inside and start to experience our body as we breathe. Now, of course, each one of you's experience of pain in your body is going to be different. But what we're going to do today is try and visualize the pain as a thing, as an object, maybe as a character. Maybe your pain is like a sharp pain, so you visualize it. Maybe it feels like a knife, or maybe it feels like a nail or something that is poking into you. Maybe it's a throbbing pain. Maybe it has a rhythm to it. Maybe your pain looks like a character, like a cartoon character, or maybe it looks like an animal. I know this might seem a little left field, but if you can visualize your pain, maybe it has a shape or a color. Maybe it looks like something that's pushing into you, or something you can visualize inside yourself. And as we keep breathing and you settle onto something that we can work with. I want you to really focus on the shape and the size and the color of whatever it is that you've picked out. And very simply, what we're going to do as we breathe is we're going to take that and we're going to move it outside of our body, continuing to breathe. So now that your mind's eye is focused on this image, whatever you've selected, now as we breathe, we're just ever so slightly going to push it away from us a little bit. And with each inhale, charging yourself up. And as you breathe out, just with your mind's eye, just push it away a little bit further. A little bit further. And as you can see it in your mind's eye moving away from you, you can see it's getting smaller. Whatever color you gave it to begin, let's just turn the brightness down on that. So on every exhalation, whatever we visualized is getting smaller, further away from us, and also the color is turning down. Now at this point, you might find that you've moved your pain outside of your body, or your visualization of the pain. Maybe it's on the other side of the room. So now, let's push it outside of the house. And now as we start to push it away, it goes up into the sky, treetops. And again, it's getting smaller, and the color is getting dimmer. Now, perhaps what you visualize is up in the clouds, but we can still keep pushing it further away. I want you to imagine past the clouds that you can see the moon. Even if it's daylight, but sometimes we can see the moon in daylight. And as we breathe out and push it, we can visualize our pain moving up and away from us toward the moon. Pushing it out through Earth's atmosphere, getting smaller and dimmer. And you can keep pushing this away as far as you like, as far as you can, into deep, out past Mars, into deep space. Just continuing to breathe and inflate, and then breathe out and just push it away, push it away. So just keep breathing, and the music will gently fade out at the end.
The screen fades to black and then returns to Mitchell's room.
Thank you, Chris. That was great. And I know I feel a lot more relaxed right now, and I hope you do too. I want to talk a little bit more about music and specifically about rhythm. And we often think about rhythm in terms of music. But rhythm can be viewed in many different ways. So we have brain waves or brain rhythms. We have heart beats, heart rhythms, our circulatory system, our nervous system. Our sleep cycles can be measured in waves and get affected when we travel to different time zones. When there's more sunlight or less sunlight, we're affected by the environment in that way. Lunar cycles, solar cycles, breathing cycles we can play with. Rhythm affects us by something called affect synchrony, which means that when we're engaged in rhythmic activities like singing, dancing, listening to music, playing music, our biological systems are affected. They begin to get in tune or sync together with the rhythms that we're listening to or playing with. And that helps to regulate in different ways our internal rhythms. So we know from physics,
Mitchell holds up 2 metal tuning forks.
if we have tuning forks, let's say, if we hit the first tuning fork and it makes a sound, you can't hear it, I can hear it a little bit, and we bring it next to the second tuning fork, that second tuning fork begins to vibrate because the waves, the pulses, the beats go out in space and connect.
He strikes the tuning forks against each other.
And they create harmony or disharmony, depending on what we're listening to. And the larger force has a greater effect on the weaker force.
An image of 2 tuning forks appears against a white background, depicting the concept of entrainment as blue sound waves emitting from one fork and causing the other to resonate.
This phenomenon of the tuning forks and sound waves and beats per minute is called entrainment. Basically, what I already said, we connect to the beats that are happening. And it can be in our thoughts, it can be in our emotions, it can be something physically happening to us, hormonal changes. It all affects our inner states. And we can begin to regulate these inner states, especially when it comes to pain management. Now, oftentimes you might hear about these beats per minute as waves, such as beta waves, alpha waves, theta waves, delta waves.
An image of the 4 waveforms appears, depicting beta waves as a quick, jagged repetition of crests and troughs, alpha waves as a steadier and smoother shape, theta waves as becoming more elongated, and delta waves appearing as nearly a smooth curve across the page.
Now, beta waves relate to being alert and awake. Alpha waves, more calm, reducing stress. Theta waves are a deeper, slower pulsation or rhythm, and they help to get us into a deeper meditative or trance-like state. And then delta waves are even slower, and this is related to very deep sleep. Now, there's been a lot of studies done with Parkinson's, stroke patients, traumatic brain injury patients, aphasia, cerebral palsy, and pain management in the use of rhythm through music and movement to help change, regulate, affect these different ailments that are going on. Okay, so now Manny is going to lead us in a little movement and rhythm experience. So enjoy it.
A large Arts for the Aging flame logo appears in the center of a black screen. Text in all white lettering reads, Arts for the Aging teaching artist, Manny Arciniega. The screen fades and reveals a seated individual in front of a large gray wall. To his left is a large hanging plant with green and red petals. A mix of sunlight and shadows splash against the wall's surface, revealing a coarse, stone-like texture. Manny is seated in the center of the screen. He is a middle-aged man with light brown skin and long dark brown hair pulled up into a ponytail. He has a trimmed beard and mustache with streaks of gray hair on his head. He is wearing dark blue trousers and a gray-blue short-sleeved collared shirt with white buttons down the center. During this section, images of the instruments used to create the soundtrack appear on the screen and play along with the music. The instruments are woodblocks, claves, kashishi, shekere, cowbell, conga drums, and an African thumb piano. Hi, my name is Manny Arciniega, and I'm a teaching artist with Arts for the Aging. And as Mitchell mentioned, I'm going to lead you through some simple movements while listening to some rhythmic music. Now, I'm going to do these movements in a seated position, but you can do them in any position that feels comfortable for you. Remember, do what feels natural for you and follow the advice of any physicians or doctors. The concepts we're going to talk about can be applied to a wide range of music and a wide range of exercise, stretching, or just simple meditation or breathing. Speaking of breathing, let's go ahead and get our body breathing in rhythm. You should be hearing a rhythm instrument right now, keeping a nice, steady pulse. So along with me, let's count the beats of this pulse using a 4-beat cycle. Sounds like this. 1, 2, 3, 4. 1, 2, 3, 4. Now breathe in. 2 in through your nose. And out through your mouth. 3, 4. Keep that cycle going. 2, 4. Out. 2. Fantastic. 3. This time, breathe in and look up to the sky. 3, 4, and out. 2. Take your chin to your chest. And in, back up to the sky. 2, 3, 4, and out, bringing your chin down to your chest. 3. Great. Take your head and move it to the side. 3, 4, and other side, breathing out. 2. Good. We're going to do this again. Remember, in, do what feels comfortable and natural for you. If you have a different stretch, go ahead and do that. Great. In, 2, bring your head back to center. 3, 4, and out. 2, 3. Great. Bring your shoulders up to your ears. 2, 3, 4, and out. 2. Relaxing your shoulders all the way down. Do that one more time. Breathing in, bringing your shoulders up, and out. Letting go of that tension. Great. Take one arm, breathing in, stretch it up to the sky. And breathing out, bring it back down to your lap. 3. Switching arms, breathing in. 2, 3, 4, and out. 2. Good. One more time, back to the other arm. And in. 2, 3, 4, and down, breathing out. Switching arms. Breathe in. 2, 3, 4, and out. 2. Great. Let's do both arms together. Taking them up as high as you can go. And down. 2. That might not be very high. Let's stop halfway this time. In. 2, 3, 4, and out. Good. I like to shake my arms out, get the blood flowing. Still breathing in, and now I'm breathing out. Great. Let's do that in a little bit of motion. So turn some doorknobs to start. Still breathing in. And out. 2. Great. And how about we fan ourselves? Been working hard. Deserve a little breeze on the face. Continuing our breathing. Great. Switch directions and play some air drums of yourself. Breathing in. And out. Back to just shaking it out. Breathe in. And breathe out. Very nice. Take one arm. Hold it in front of you. Stretch that. Fingers back. And breathe out. Great. Switch. Breathe in. 2, 3, 4, and breathe out. Great. And another big deep breath in. 3, 4, and out. 2, 3. Continue your breathing. Breathe in. Remember, apply this concept, breathe out, and the idea of moving and listening to the rhythms, to any stretch or meditative exercise that you'd like. If you have a particular rehab regimen, maybe you could perform it along with any music. Make it music you enjoy listening to. As the music fades, an image of a dark wooden thumb piano moves closer to the screen before eventually fading out and revealing Mitchell seated in his room.
Thank you, Manny. That was great. I feel energized and I feel relaxed. And you can begin to feel the effects on rhythm and music and how it can help to regulate, as I was saying before. Now, it does this by something that's called music-induced analgesia. And this has to do with many factors.
A large image depicting the locations of color-coded brain responses to music participation appears on the screen.
One is empathy. One is secretion of different hormones like oxytocin, dopamine, and cortisol. Now, first, let's talk about empathy. You know, when you are singing in a chorus together, playing in an orchestra, playing in a band, dancing at a wedding, listening to music, you begin to feel connected in ways that don't just happen in ordinary experience. Now, this is because music and movement can help to create this feeling of deep connection and camaraderie, feeling connected because we're in the same rhythm together. So we're deeply, deeply connected. There is a person at the University of Chicago, Gene Zasserti, who is the Irving B. Harris Distinguished Service Professor in Psychology and Psychiatry. And Gene says, music is a fundamental part of our evolution, allowing for unique expression of social ties. It can strengthen cohesion and mutual trust between people by signaling shared values. This is what empathy is, and this is what music can do. Now, oxytocin has been called the love hormone. That's because when we're in love, or when we're feeling love for someone else, oxytocin is released in the body. Oxytocin is also released when we listen to music that we really like, when we're really engaged in this musical activity. Stimulates the immune response and helps us to relax, decrease stress, and of course, affect pain. Dopamine is also another one of these happy hormones that they call. A recent study in the Proceedings of the National Academy of Sciences has found that when we listen to music, engage in music, and we get those kinds of chills, our hair standing up on the back of our neck, or goosebumps, that this is because dopamine is being released. It's associated with having pleasurable experiences. Cortisol is also affected. Cortisol usually gets released when we're stressed. It helps us to stay alert when there's danger. But when we listen to music that we really like, or play music together, cortisol has also been shown to decrease. So this is very important when thinking about pain management, because it affects the pain pathways as well. Helps us, again, to relax and to have enjoyment. This helps to balance out the experience of pain. So thanks for listening to me. I'm going to turn this over to Manny and Chris, who are going to lead us through a bunch of musical experiences. I hope you enjoy, and please keep listening to and engage in your favorite music.
Manny appears seated in the center of the screen. His backdrop has been replaced by a large brown wooden wall. In front of Manny is a small long microphone on a clip and stand. For the final portion of this video, Chris and I are going to invite you to join in and make some music with us. We'll get the ball rolling with some rhythm and some music, but then we're going to show you a few simple patterns using our body and our voice to create some sounds and some rhythm and some music with us. Remember, do what feels natural and comfortable for you and be safe. Please follow the directions of any physicians or doctors, but most of all, have fun. Manny fades out, and now Chris appears in his music studio, still with a bird's eye view. He pushes a button on one of his many machines to start a drum track before playing his bass guitar. Manny appears playing 2 conga drums against the bright blue brick wall covered with fall-colored leaves. The camera cuts back to Chris's music studio where, thanks to modern video editing, Manny is now playing congas in the corner. With each new added instrument, an image of Manny appears, playing that instrument.
Alright, can you feel the rhythm and the pulse of the music? The first thing we can do is find the pulse and just play along with it. So, why don't we try using our feet, if you're able. Let's think about the big beats. We'll count them together using our voice and just get our body moving to those large, slower beats. Here we go. And 1, 2, 3, 4. 1, 2, 3, 4. If you're seated, 2, 3, 4. You can tap your foot or move your whole leg. 3, 4. If you're standing, maybe march in place. Get your upper body into it. Whatever feels comfortable and natural. Keep that going as long as you like. 1, 2, 3, 4.
Manny continues to move his legs to the beat of the music as his image shrinks and continues in the corner of the screen.
Very good. Let's add another part of our body. And maybe think about the pulse a little differently. Taking my hands, I'm just going to tap my legs to a slightly faster rhythm. I can count it along, just like this. 1, 2, 3, 4. 1, 2, 3, 4. Keep your hands playing together, or go back and forth. Whichever feels more comfortable.
Manny's image shrinks and then grows while continuing to pat his legs.
There you go. Now for you singers out there, we can get our voice involved. Maybe a simple pattern or a couple simple patterns to start. Try this one on for size. Big breath. Ow. Ow. Ow.
A singing, floating head joins the ranks of the other instruments and body movements around the screen.
Great. If that's a little too low, we can sing something a little higher.
There are now 8 Mannys around Chris on screen, walking in rhythm, patting legs, singing, playing congas, triangle, cowbell, and a brightly colored shekere.
It's getting groovy. Can't have a funky groovy beat without a backbeat.
Manny claps his hands along with the backbeat.
And if you don't feel like playing, you can simply move your body or sit back and enjoy the music. Let that smile come over your face. Just feel good. You deserve it. Thank you so much for spending your time with us today. Big thanks to Chris Brown on the bass guitar and to Mitchell Kosak for all of the wonderful information about managing our pain through music. Have a wonderful rest of your day. Thanks.
As Chris and Manny continue, the image fades and credits appear. The first page of credits contains information referring to the production of the video. The second page of credits contains an abbreviated bibliography, image credits, and a note that more information and research can be found in an accompanying slide deck available for download. A list of Arts for the Aging funders appears, along with the logo for the National Endowment for the Arts. A small image of Manny playing two squeaky toys floats across the screen. The Arts for the Aging flame logo appears against the black screen with text for a website, www.artsfortheaging.org. Both images zoom away and fade to black.